Hi, my name is Dr. Jennifer Brandt. Today I'm here to speak with Dr. Kiana Johnson, and honored to be with her today. Kiana, could you take us back in time just a little bit and tell us about your diagnosis of lupus and kind of take us through that?
I was diagnosed with lupus when I was 12. I believe it was 1996. And we'd gone maybe a year or two with just having random fevers. And at some point, my 8th grade teacher, Mr. Ferguson, came and pulled me aside one day and was like, you know, Kiana, you have these bruises on you. Is everything all right at home? And I was like, yeah, what kind of question is that? And so I talked to my mom about it, and we went to the hospital right then and there. They did a series of different tests, and that's when they told me that I was diagnosed with lupus.
Could you tell us a little bit about your pregnancy journey and your journey with having children as a person who has lupus?
Yes. So I had to really work at not being anxious.
Okay.
And then I feared having a miscarriage. And I know just with a lot of lupus patients, and we didn't have any issues with, like, we had some spotting that really scared me every time that would happen, but I was just like, you know, oh man, I wore out a bad pair of knees for praying for my last baby for Kennedy Clarence.
Yeah.
And really trying to keep myself in a good space so that maternal stress wouldn't have an effect on the baby. So the nervousness or the anxiety just never stopped, because I was like, oh man, you know, after birth is when many people have a flare because of the change in the hormones. Mm-hmm. So I didn't really get to enjoy that process because I was so nervous about all the what ifs. Right. Yeah.
How did your rheumatologist take you through that conversation? If you remember when you were asking all these questions, because you were saying, okay, all these things could happen.
Now that I look at it, I'm like, yeah, she's been a pretty good cheerleader throughout the process.
Yeah. Along the lines of contraception, it sounds like you mentioned that when you were young, that conversation wasn't had with you, or you weren't asked if you were planning pregnancy. Yeah. So I think you've underscored a point that it's really important for us to talk to our patients about it, mm-hmm. and not assume, like you said, that this person is or isn't going to get pregnant, because you just don't know.
Right, just provide the information, yes. Yeah. Just so that people make informed decisions about their activities.
You are a mom now, and tell us, what is that like to be a mom who also has lupus?
For the most part, I want to live, mm-hmm. period. Yeah. So before I got married, and you know, it was just myself and my kiddo that I had adopted, I hadn't considered, like, I had about a 2-year stint where I hadn't gotten sick at all. And I think I forgot and kind of took that for granted. Not necessarily take it for granted, but at some point I got sick, and it ended up I had sepsis. So I was in the hospital for like a week and a half, and it was great that I had some colleagues who were also good friends who took care of her. She stayed with them. And it was rough for her coming to the hospital, because every time she left, it was like this meltdown. But I needed for her to see that I'm doing okay. Yeah. And it actually hasn't changed. It's when I had my son, it's kind of intensified. It's like, I can't get sick. I can't, and kind of in the same way that I was a little bit anxious during the pregnancy. Between that and then the healthcare, you know, where I lived, really being an advocate for wanting to live, and not just live to thrive. Yes. So are people giving me the best decisions? Are they giving me the best options where I can thrive? You know, at the back of my mind, it's just like, I have this desire to be around for quite a long time. Mm-hmm. And then also make sure that, you know, I can also be that advocate for my kids.
Wonderful. And from our conversation, I think there's some really important points to take away from what you've taught us during this conversation. I think it's very important for us to not assume things about our patients, to ask questions. It always comes back to asking questions from the provider perspective. As a mother with lupus, you highlighted that there are many different ways that someone can embark on the journey to becoming a mother, through adoption, through biological pregnancy, and many other ways. There's not just one path for that. You also mentioned to us that the importance of being an advocate for yourself. And I think that is incredibly important, and I think that as providers, we really have to encourage our patients to be an advocate, speak up if something doesn't seem right so that we can help them, relevant to patients who are pregnant or not pregnant, but just sort of along the journey. Kiana, thank you very much for your time today, for sharing your story with us, and for teaching us today.
Thank you so much for having me.